Polycystic ovarian syndrome, or PCOS, is one of the most common conditions disrupting hormone secretion in females and is a leading cause of female infertility in the United States. In short, PCOS is an imbalance of an estrogen called estradiol and progesterone, which leads to the growth of harmless cysts on the ovaries. Symptoms of PCOS include an unpredictable menstrual cycle, a condition called oligomenorrhea, abnormal hair growth, acne, insulin resistance, high blood sugar, and, as mentioned, infertility. Women with PCOS are also more prone to anxiety and depression, diabetes, high blood pressure, high cholesterol, heart disease, strokes, and ovarian and uterine cancer. With symptoms and increased risks like this, you might be wondering what exactly is happening inside the body to cause these things. Let's take a closer look at that. The pituitary gland secretes two hormones that act on two different cells in the ovaries. The follicle-stimulating hormone, FSH for short, works on the granulosa cells, and the luteinizing hormone, LH for short, works on the thecal cells. During a woman's normal menstrual cycle, thecal cells convert LH into androgens, namely testosterone and androstenedione. These newly converted hormones are then taken over to the granulosa cells and are converted into estrogen, namely estradiol and progesterone. PCOS occurs because the pituitary gland secretes an abnormally high amount of LH into the bloodstream. What happens when LH is elevated is that the granulosa cells are not able to work fast enough in changing androgen into estrogen, which results in excess androgen. In addition, it's important to note that thecal cells also produce insulin-like growth factor type 1, or IGF-1 for short. The reason this is important to know is because the production of IGF-1, coupled with excessive androgen levels, gives off several of the symptoms related to PCOS. One of these being oligomenorrhea, which, as mentioned before, is an unpredictable menstrual cycle characterized by heavy periods spaced far apart. Someone with PCOS will also notice some weight gain. This is primarily because insulin-like growth factor type 1, IGF-1, makes it hard to lose weight. With weight gain comes the production of adipose tissue. The interesting thing about adipose tissue is that it contains the same properties as granulosa cells do. Where granulosa cells change androgens into estradiol, the most potent of estrogen in the female body, adipose tissue can change androgens into estrone, a relatively weak estrogen. Estrone then communicates to the brain that there is plenty of estrogen for the body, which then decreases the production of FSH and stops the production of estrogen. This cycle, known as PCOS, then repeats itself over and over again. To treat PCOS, we can disrupt this cycle by prescribing birth control pills or inserting an IUD. We can treat hirsutism and acne with estrogen hormone therapy. Metformin can also help with insulin resistance caused by IGF-1. What ultimately makes PCOS go away, however, is weight loss. You'll notice that by removing the creation of excess adipose tissue, your body is able to reset itself, and usually the symptoms related to PCOS go away. Admittedly, being told you need to lose weight can be very frustrating to hear. As a result, we like to offer a couple recommendations that might make weight loss a little easier. First, improving your diet will go a long way to reducing and maintaining a healthy weight. Focus on a balanced diet with lots of fruits and vegetables. In addition, exercise of any kind can help reduce and maintain a healthy weight. Each woman is different in what exercise works effectively for them, and we can talk more about your specific needs together. That's it for this video. We hope this information was helpful. Please don't hesitate to ask us about anything we may not have covered. Thanks for watching.